Greetings from Pasadena, California. My name is Mike Soderling, and I direct the organization now called Health for All Nations. We have, over the course of the last 13 years, evolved from what initially started as a best practices in global health missions initiative to the Center for the Study of Health and Mission, to just the Center for Health and Mission, to now Health for All Nations. And there's reasons behind this change. What we do and promote remains the same. Our desire is to see people in every nation at least having the opportunity to live a life of health and wholeness. We have several initiatives. We think the name change better reflects what we're about, what we want to see, rather than what we are. We really aren't a center which has a physical location, although we have a physical mailing address where I happen to be. The new name more accurately reflects what we're about. And the Christian Journal for Global Health continues as strong as ever. The Best Practices in Global Health Missions Initiative has the leadership now that will move that forward in a more active way. We have been working on and are probably 70 to 80% through developing a course, which is a sort of an augmentation of the Perspectives course, and we call it Outlook on the Christian Global Health Movement, which will be available, we hope, before the end of this year. So what we've been about all these years remains the same, but we felt like the name change would better reflect what we are about. So Health for All Nations is about what I mentioned before, seeing people living lives of health and wholeness among all nations. Now, this goes back to the Alma Ata Declaration of 1978, which stated health for all, and at that time it was health for all by the year 2000. And this was referred to frequently by my longtime mentor, Dan Fountain, as something that was rather ambitious, and I think most people who were there in 1978 realized it was a pretty ambitious goal. And actually by the year 2000, I don't think things had improved that much. But since that time, the health for all has continued as an important focus. There's all manner of global health initiatives now, from World Health Organization, Doctors Without Borders, Johns Hopkins, Harvard, many places where they do global health, where they send their students into global health locations to do work in developing nations. So it is extremely popular. Much financial backing is being sent to help people live healthier lives around the world. So Health for All Nations is something that has been around for a number of years, so 47 years. And we added to the end of that nations, just as a reflection of our desire to see that people from all nations have the opportunity to live a life that's healthy, full, self-fulfilling, achieving their level of creativity, all manner of different ways of describing it. Some call it human flourishing. We come from a distinctly Christian faith-based understanding of what health is. And that can all be discerned from our website. And so this is just a freshening of our name, maintaining vision and mission, and we will now be ramping up some of the other things that we offer. One thing we are very excited about is our collaboration with the Ralph Winter Launch Lab, which is an innovation center here in Pasadena. I'm a collaborator with them, and we are developing what are called transformation collaboratives, or TICO labs for short, which build on systems thinking, complex adaptive systems thinking, the U theory, all sorts of new thinking about how to tackle complex problems from a multidisciplinary, interdisciplinary approach. So those will be offered very soon, hopefully this year. So we hope you appreciate the new label, the new look, and we look forward to your involvement in helping us move this forward in a more active way. So thank you.